I'm Anu Jacob. I'm a professor of neurology and the director for the Comprehensive Multiple Sclerosis Program at the Cleveland Clinic in Abu Dhabi. Multiple sclerosis is a treatable condition. It is true that we can't prevent multiple sclerosis because the mechanisms of how MS starts is still being understood. However, we have many medications that can prevent new inflammation from happening in the brain and spinal cord. We also have many medications that can address the symptoms of MS, for example, pain, weakness, or stiffness, or bladder or bowel problems. How effective, how impactful these medications are going to be will depend on how early you diagnose MS and the choice of the disease-modifying therapies. Multiple sclerosis is a condition that typically is diagnosed between the ages of 20 and 40. But we know that it can happen in younger ages, teenagers and children. It can also happen above the age of 40. It's much more common in women than in men. MS is a global disease, but typically the most common people affected are Caucasians or white European people and their descendants who have migrated to the continents of Americas, Australia or New Zealand. But we also know that MS is rising globally, and even in the UAE we have a large number of people, both of Emirati as well as expat population, in whom the diagnosis of MS is increasingly being made. There are many lifestyle changes that people with MS can adopt. First of all, eat healthy, avoid obesity, exercise both your body and mind, ensure adequate sleep and go out in the sun, get some vitamin D. Make sure you stop smoking, that's really crucial. Manage well all the other diseases that can impair your brain health, for example, high blood pressure, high cholesterol, diabetes. But most importantly, have a positive approach towards MS and life. Yes, you may have MS, but MS is not in charge of your life. You are in charge of your life. You are in control.